Well, good afternoon, everyone. Thank you so much for all of you joining ONEgeneration's Health and Wellness Webinar Week. Thank you so much for all of you that's been with us this entire week, joining through the presentations and just being interactive and just asking questions. We appreciate all of you for being here. For those of you who do not know me, my name is Niambi Cooper, and I'm the director of ONEgeneration Senior Enrichment Center, and we're led by our organization's president and CEO, Jenna Haas. So this webinar layout will be composed of first playing a very informative video, and then we will have questions and answers at the end, but please feel free throughout the entire presentation to use the chat function at the bottom panel of your screen. And you can also use the Q&A function, and you can use a function called raise your hand at the bottom, and that will allow you to verbally ask a question to our presenters. So this presentation is being recorded, and that just simply means that we're able to replay this video over and over again, and we're able to place it into our ONEgeneration newsletter and on our website. So if you do not already receive our newsletter, you can reach out to us at our office number, 818-705-2345, or you can just go to our website, onegeneration.org, and then just input your email into the section is titled newsletter, and then hit submit, and then you can start to receive our newsletters on a regular basis. So I'm super excited to introduce the amazing Providence team that we have here today. The doctors are in the video are Dr. Anna Lopes. She's a primary care internal medicine physician with Facey Medical Group. Then we have Dr. Rene Gonzalez. That's the chairman, Department of Pediatrics with Facey Medical Group. Jasmine Hostel, community health worker with Providence Community Health. Then we have Lily Bouvet that's here on the call as well. Concha, Ruben, and Rolando. So I'm super excited for you guys just to be here. Thank you so much for joining us. It's good to see everyone.
Thank you for having us, Niambi, and welcome everybody.
And I'm going to go ahead and share my screen.
Hello, thank you for joining us today at our COVID-19 Community Forum. We have a very special presentation from some of our doctors here today who is going to be sharing some very valuable information for us. So doctors, can you please present yourself?
Hi, my name is Dr. Anna Sophia Lopes. I'm a family physician and I work at the urgent care at Facey Medical Group.
Hi, I'm Dr. Rene Gonzalez. I'm a pediatrician at Facey Medical Group. I'm the chairman of the Department of Pediatrics, working in pediatrics for the last 18 years.
And I'll be your presenter here. My name is Jasmine Hostel. I am a community health worker with Providence. So thank you so much, and we'll get started with the questions. Dr. Lopes, Latinos are disproportionately affected by COVID-19 as comparison to other ethnic groups. Can you please share with us some of the information that we know?
Absolutely. We can start with numbers. When we look at the table, we see that the communities here in the San Fernando Valley still show high case rates. When we look up other areas in Los Angeles, Malibu, Palmdale, North Hollywood, Sherman Oaks, the areas where Latinos live have higher case rates of COVID. That is very worrisome because it leads to more deaths, and we know that. This is a population that's very susceptible to COVID-19, not because of any genetic predisposition, but because of economic and socioeconomic forces.
Thank you. And what should be done to help lower the rates among Latinos?
I have strong feelings about this, but I think it starts with a major reform of our economy and who's able to work from home. I think that Latinos make up a large percentage of our essential workers, and I want to share my thanks for all the frontline employers who have helped us survive this pandemic by being in our grocery stores, keeping our schools open, delivering our packages. Most of the workforce has been the Latino community. So they are the fabric and they are essential to our economy. But because they cannot stay home, they're less likely to be able to work from home. The wages that they're earning are not necessarily living wages. They also may not have health insurance, and they may not have access to medical care or a medical clinic. This is causing discrepancy and inequity in what we're seeing in the community among Latinos.
Thank you. And in those Latino communities, can you please share some of those vaccination rates that we see, especially when it comes to younger populations getting vaccinated in comparison to the senior populations?
Yeah, so when we look at the vaccination rates by communities and age groups, we have much higher percentages of elderly that are vaccinated, which is fantastic. So I want to congratulate all of those who have gotten their COVID-19 vaccinations. Thank you for doing your part to protect our communities and helping to end this pandemic. We still are not there yet in terms of vaccinating patients or people who are 16 and older between the age ranges of, I guess now 12, Dr. Gonzalez will talk about that, 12 to our 64-year-old group. And we have to really look at what are the barriers. Is it a language, a literacy issue or a language barrier? Is it immigration concerns that prevent people from getting to the vaccination or deter people from getting the vaccination? Is it that you can't take days off work? All of those things are very important. Also, basic things like transportation, access to the internet. That shouldn't be so much of an issue because the vaccine is now available throughout the community. So we have to explore the data and understand why this population is not getting vaccinated.
Thank you. And what motivation or what resources that do we have from the county for people to get additional information to decide whether or not they do want to get vaccinated and if vaccines are safe for them?
I think, Jasmine, you can answer that question about resources and where people can get information. But I do want to point out that, the fear in the Latino community about vaccinations is very real. And I just want to acknowledge, as a physician, I'm part of the system, and I understand that. And I just want to acknowledge that if anyone's watching, we are aware that there's vaccine mistrust in the Latino community. People may not feel safe signing forms that they can't read. And we understand that, and we're still advocating for the Latino community to get the vaccine because we feel it's the best protection that we can give to someone so that they don't get COVID. In terms of resources, the cdc.gov is a great source of information. Also, Jasmine, you can also remind us of where we can get good information and resources to the community about the COVID-19 vaccination.
Thank you. And one last question, Dr. Lopes. Should people continue practicing wearing a face mask, social distancing, or after getting vaccinated, is it okay to draw away from those practices that we used to do before?
there's been some confusion because the CDC guidelines have mentioned that face coverings are no longer needed if you are vaccinated. And while I understand why they dropped the requirement for face masks, I think when you look at the vaccination rates among the younger populations in certain communities within the San Fernando Valley, I think the CDC may think twice if they had looked at the vaccination rate in some of those communities where we only have 40% of people vaccinated between the ages of 18 to 64. So I would recommend that you still do your due diligence. If you are amongst your friends and everybody's vaccinated and you're outdoors, it's probably safe to remove your face covering. But if you're in large crowds, if you're indoors, definitely follow your preventative steps that we've been doing all along since the beginning of the pandemic.
Thank you. Yes, it's good to keep practicing, especially when we're not sure. Those face mask wearing, washing your hands. Thank you, Dr. Lopes. Dr. Gonzalez, can you please tell us how the vaccines were developed and what type of protection it gives us?
Sure. So I'm going to comment on the concern about the development of the mRNA vaccinations, which is the Pfizer and Moderna. A lot of people have been concerned that it's a new technology, but people have actually been doing studies and research in this technology since the early 90s, so almost 30 years. And the technology was developed as a way to try to develop vaccines where you didn't have to use a live component of the actual virus or the illness, or even an inactivated form of that virus. Luckily with the mRNA, they were able to actually use proteins within the virus itself. Once they identified the COVID-19 virus and the genetic makeup of it, they were able to develop, using mRNA, the proteins to develop the vaccine, so that when it is given to patients, the body is able to build an immune response without having to get a live or mutated form of the actual illness. So it's not new technology. It's been around for about 30 years. Luckily, it's been put in practice now, and vaccine was able to develop much quicker because once identified it, they were able to develop the vaccine quickly, start those phase studies, and so it's a very safe technology that's been developed over many years, and luckily it came in time for this pandemic and the development of these vaccinations.
Thank you, Dr. Gonzalez. That's definitely comforting to hear. Now that the FDA has authorized the vaccine for adolescents of ages 12 to 17, parents have many doubts and questions about the safety and effectiveness of the Pfizer vaccine for their children. What are your general recommendations?
So the biggest thing I always give parents is reassurance. Vaccines, when they're developed, they go through testing, research, clinical studies. So even though they may seem it's something new, there are different studies that have many patients enrolled. For example, the 12 to 15 population has been enrolled since last year. Once they finished the studies, which included over 2,000 patients in that age group, they did the different phase studies to confirm, one, that the vaccine was safe with minimal side effects, two, that it built an immune response, and three, that it's going to be effective in preventing the complications or the severe illness of COVID-19. And luckily, the vaccine did show very good study responses. I actually had better rates than even for the adult population. They showed about almost 100% efficacy in preventing severe illness, hospitalization, or the complications that we see from COVID. So it's a very safe vaccine, not just in adults, but also in this age group. And they're actually doing the studies now for those under 12, which is most likely also going to show a good response.
Thank you. And how can parents take care of their children after their children have received the vaccine? And are all the side effects that children can possibly get the same that as we've seen with adults?
So most side effects are pretty similar to any vaccination that we tend to give our pediatric patients, be it a COVID vaccine, be it a flu vaccine, be it their standard immunizations. The biggest thing, of course, is discomfort at the injection site, inflammation at the injection site, a small chance of developing fever. Some will develop some body aches, chills. But in general, most of those symptoms are mild, they're brief. They usually resolve within a few, 24 to 72 hours. And definitely, it's not to the point where we see a patient have to be hospitalized. I know they do an observation period after the vaccines are given, looking for any acute reactions, which are also pretty rare. So we monitor them. We give recommendations for using supportive cares, compresses to the injection side, Tylenol, Motrin, supportive cares, and just observation. Most pediatric patients are used to getting several vaccines already. So most of the time, we're not going to be seeing very much different than they would have gotten with any other vaccine.
Thank you. And another concern that comes amongst parents is, can the vaccine cause infertility in children?
So there really is no studies or any evidence that takes place. Like I was saying, this is an mRNA vaccination, so it's not really involving DNA or any of the DNA components in our body or in our genetic code, so there'll be no alterations in that. It doesn't go into the nucleus of any of our cells. It doesn't go into any reproductive organs, ovaries, testicles. None of those are going to be affected as a side effect or a long-term effect. So those fears and those concerns really haven't been shown to be anything of concern.
Dr. Lopes, do you want to add anything that you think might be helpful, especially when trying to make that decision regarding to infertility, as we see that kids are aging, and if maybe that could bring additional situations or complications in the future as adults?
Well, as Dr. Gonzalez said, the vaccine safety is there, but we understand that the community has a lot of fear about this new technology, which it's new to them. It's not necessarily new to science. What I can tell you is that the partnering organization, the American College of Obstetrician and Gynecologists, so our gynecological colleagues, they're recommending this vaccination to their pregnant patients. The World Health Organization has also made recommendations that it is safe to breastfeed your infant or your child when you receive this vaccination. So there's more and more data showing that the vaccine is safe. There's a lot of misinformation, as Dr. Gonzalez pointed out, and you're probably alluding to, Jasmine. And it's just very difficult as a physician to hear all of these they're concerns, but they're not based in science. We wouldn't recommend anything that would cause harm to our patient population. And I think that's really important. As Dr. Gonzalez spoke about, there have been safety trials, and once they were deemed safe, that's when the companies applied for emergency use authorization. So this is something that we take very seriously as physicians, and we're glad just to have the opportunity to state the facts and dispel rumors about the vaccine.
Thank you. Dr. Gonzalez, coming back to you. Last week we had a patient in our COVID vaccine clinic who shared with us that her husband hasn't made up his mind if he wants to get vaccinated or not. Can you please tell us the importance of why the entire family should get vaccinated if that is the case?
Yeah, I think with any illness, disease, goal of prevention is, the more people that are protected, the more people that have that immunity, the less risk there's going to be. All it takes is one exposure, one contact, one family member who goes to the store, goes to a school, gets exposed to somebody who wasn't immunized, gets the illness, and then passes on to that other person. So even though they may think there might be herd immunity in their own household, they can only protect what's happening in that house, not everything else outside in the environment. So we definitely have seen, even in our own population, patients who get vaccinated, one family member not getting vaccinated for something like the flu, that person gets the exposure, that person gets very sick, the rest of the household may be protected and not have those signs, symptoms, and potential complications. So, herd immunity does work to a degree, but it really only works if, a significant number, 70% or greater of the population is vaccinated. And with the numbers that we heard, we definitely are not there. So the whole household as a unit really should be protected because you don't want one person to unfortunately end up with the side effects, consequences of this illness.
Thank you. Dr. Lopes, do you want to add any suggestions on how to have these conversations with our family members who might be a little hesitant on getting the vaccine?
Yeah, I think it's just honest conversations. Once, when somebody's not vaccinated, I also meet patients who are not vaccinated coming in for COVID testing, which, and I ask them if they're vaccinated. It's just part of the history now. And if they say yes, great, ask them how they went. If they say no, I ask them why. And a lot of the whys, I think people are just afraid still. I honestly think that's what it is. And I also think they don't know much about the vaccine. And it does require trust, and we acknowledge that in the medical community, that the trust has to be there. Some people don't have a doctor that they can talk to. They don't have Dr. Gonzalez. They've never been to the pediatrician. They got all their vaccinations, and then they're not even coming to see a primary care doctor as an adult. They might just come into the urgent care and see someone like me. So I think it's really important for the community to know that the physicians want to help and they want to answer your questions. And there's lots of data out there that can kind of guide you. But we, as physicians, we are recommending the vaccination. We feel it's the best protection. We've already proven that it's safe. And we've been vaccinated first. So we rolled up our sleeves and we did this first for our families, for our communities, so that we can help dispel any myths or rumors about the vaccination and help end this pandemic.
Thank you. And as Dr. Lopes mentioned earlier, there is a lot of information, on websites, CDC websites, FDA websites that you can look up information. But us as Providence, as a community health department, also have some resources that you can take advantage of. To start, we do have 2 permanent sites where we are hosting our clinics. One of those is in Vaughan in Pacoima, and the other one is at ONEgeneration in Van Nuys. So both of those clinics do have various vaccines that we're offering at any given time. And the number that you can call for some of those, to book an appointment for a vaccine with us is 818-847-3860. You can also go on My Turn to try and get an appointment online where you can provide your own details. We do recognize that, as Dr. Lopes made mention, there might be some individuals who do not have access to online services. So that is the reason why Providence is actively going out into the community with our COVID outreach initiative to try and educate the community about the services that we are providing with Providence and when we are hosting clinics in the communities nearby. We do recognize that there are additional barriers that some of our Latino communities are facing that other communities are not. And for that reason, we're offering our clinics in the afternoons, but also in the evenings to make sure that, we are catering to that population that does have to work, that hasn't had the advantage of being able to stay home, correct? Because they are the primary providers for their households. We're also trying to make sure that if there are any homebound seniors, that we allow them to have access to transportation. And we're doing so with our collaboration with Uber and Lyft, where we are trying to get them to have a car to be able to take them to our clinics to make sure that they are able to access those vaccines. And we also recognize that many of us have lost our jobs and with that, our insurance. So we do have a health enrollment insurance program within our department that can help those individuals who do not have access to insurance or lost their insurance to be able to apply for an affordable insurance that they can have access to a doctor at this time, or be able to, if it's necessary that they have to go to urgent care or the ER, their costs is not going to be as high as it were to be if they did not have access to that insurance. So there's definitely active outreach going on from our department and our team, trying to make sure that we go out into the community, addressing those concerns that people have for themselves, that they have for their children. So definitely, if you have any questions, please call our number, and we'll make sure to try and get you the help that's needed. Dr. Lopes, Dr. Gonzalez, thank you for your time today. We look forward to having you in future presentations and providing some knowledge for our communities most in need.
Thank you.
Thank you.
Such an amazing forum. I hope everyone got some questions that they had that they was just wondering about, and hopefully some of them were touched into in this video. Does anyone have any questions today that they would like answered, or any questions about anything? There is some contact numbers inside of the chat. Also the main one from the video is 818-847-3860. That's the main Providence COVID call center for information and vaccine appointments. Does anyone have any questions?
We have a question, Nyambi, in the chat room that came in during the presentation.
Okay.
Is this, as a fully vaccinated senior, what are my chances of getting COVID infection from the unvaccinated? And thank you for your question. Lily, you want to answer? Lily, if you can unmute yourself. I think it's
okay.
muted.
Just like with any vaccine, it doesn't provide 100% guarantee that you may or may not get the disease. It does provide protection, and it does reduce the risk and the chances of getting a severe infection that requires hospitalization. But that's true of any vaccine, whether it's the flu vaccine or any other vaccine that you may get in the future. The key here is protection and protecting yourself as much as possible from other people. And that's why, they're still careful and cautious with the guidance, because there is no guarantee that and some people, a few people have gotten COVID. It's been documented that they have gotten COVID after having been vaccinated. So, but it does provide a lot of protection, a high percentage of protection. So I hope that answers your question.
We also have the raise your hand function on the bottom part of your screen that you can select, and you can verbally ask us a question.